Good afternoon, everyone. Thank you for joining the benefits for electronically prescribing both legend and controlled substance webinar. This presentation is provided through a shared commitment between Health Current, Arizona's Healthcare Cost Containment System, Access, the Arizona Department of Health Services, ADHS, and the Arizona Board of Pharmacy to manage and coordinate the statewide EPCS Click for Control education campaign. A few logistical reminders. Today's webinar will be recorded and posted to the Health Current website. Please include your chat. Please use the chat box for questions or comments. Please include your name, practice, or organization, and do not include any confidential information such as patient health information or PHI. Just a reminder that all lines are muted. Connie I. Cohen, Health Current's Director of Programs, will be our presenter for today's webinar. Connie, are you with us today?
I am, Christine. Thank you very much. Please confirm that you can hear me.
I can hear you.
Very good. Well, thank you everyone for joining. This is a webinar with a title that is very near and dear to my heart because I suddenly realized all the benefits of electronically prescribing both legend drugs and controlled substance drugs. As soon as Governor Ducey signed the law and I read it, it made perfect sense to me, so that there are so many duplicate issues for a physician's office as well as patients and others. So let's get started. As Christine said, this is a shared commitment between Health Current, Access, Department of Health Services, and also the Board of Pharmacy. When we first started this process back in 2017, we realized that so many providers were not prepared and nor did they know where they should go or how they should do it. So we all banded together, had a meeting one day, and decided that it was extremely important that we do something to help the providers find out what they needed for software, how they would make the mandate work for them, and they would follow the mandates. So it's been an exciting couple of years for us to get where we are today. And further on in the presentation, I will talk a little bit about where the state of Arizona is relative to the rest of the nation. So that's a very interesting subject for me as well. So today I'm going to be covering the benefits of e-prescribing, and I'm going to talk a bit about prescriber specifics. What is specific to the prescriber? What does e-prescribing do for them? And what does doing both the e-prescribing of legend drugs as well as controlled substances, what does that buy them in their process and their practice? And then I'll also talk about patient safety. And patient safety is kind of a combined subject because it not only covers patient safety, it covers some things for the patient that makes their lives easier, and also is things that will make the prescriber and his team easier for them to follow. As I said, I'm going to talk a little bit about EPCS statistics. Good news, I want to talk a little bit about the continuing medical education free opportunity that happily I have a good announcement about that. You'll love it. Also, we'll talk a little bit about the Click for Control campaign resources that are still available and some newsworthy upcoming events that many of you may know about, but some of you may not. So I suggest that we go through those so that we know what's going on. So without further ado, let's talk about the provider specifics. I'm not going to go over this slide with you. I left it in, and for those of you who will print the that will look at the slide deck when it's sent to you by Christine later after this. Someone keeps interrupting me here, so I'm having a little bit of trouble. Anyway, back to what I need to tell you is I've left this slide in so that you all could see what was coming up when you were going through the process of reviewing the slides. So I'm going to start with one workflow for prescribing controlled substances and legend drugs. So what does that buy the prescriber? It allows them to seamlessly prescribe both retail and mail order pharmacy orders. And that's especially important through the pandemic because, as you know, many providers are offering virtual visits. So without the provider, without the patient coming into the office and meeting face-to-face with the prescriber, there's no way to get the handwritten prescription to them other than through the mail or having the patient stop by and pick it up. So more and more prescribers and more patients are suggesting the mail order pharmacies be used when they can, especially for routine drugs that the patient may be using. It's a more efficient process with the same procedures. So if you think about back in the day when you were writing prescriptions and doing some electronic prescribing, you had two different systems that you needed to be in control of. So you had to do one process for one and another process for the other. This also supports medication adherence because you'll be able to see what are the drugs that the person is using presently and understand better what they're doing. It also gives you the opportunity to check the PMP, the Prescription Monitoring Program here in Arizona, which is mandatory, that you will be able to see the prescriptions and drugs that are being prescribed for that patient by others as well as yourself. And it's also an increased convenience for patients because they know they'll get used to getting the prescription sent directly to the pharmacy and they won't have to worry about losing the prescription and all those kinds of issues with carrying the paper. Monitoring controlled substance prescriptions, it gives you the ability to track the controlled substance prescription that the patient received. You'll be able to view instantly what their medical history is, and you won't have to manually reconcile the list of medications or commit to clinical information to memory, such as drug-drug interventions and all those kinds of things. It reduces overprescribing because you can see all those things, and obviously we all know it curbs doctor shopping because by going out to the PMP or looking at the patient's record, if you are a member of the HIE, you will see the prescriptions that they have and be able to see if they are actually doctor shopping, getting prescriptions from multiple areas. It's also easier for states to track in the controlled substance prescriptions by using the controlled substance PMP. Almost all states have it. It's a federal requirement. So Arizona has it. It's run and managed very, very well by the Board of Pharmacy. We've several times had Lynn Curtis, who is an expert at the PMP, has an expert understanding of the PMP. He will be doing next month's webinar, so I will show you the data of that later on in this program. You can reconcile your medication, your medical histories quickly. It's an instant view, as I said, of the patient's prescription. You'll be able to tell exactly if the prescription often includes clinical information such as drug-drug interaction notices, your EHR. If you're working with an EHR, many of them have a lot of information like the clinical information notices, pharmacy fill data, pharmacy benefit management, the PMP data, pharmacy benefit management data that you can get through your EHR. That has become a godsend for a lot of providers. It also helps with meaningful use requirements, both for the PI, the Promoting Interoperability Program, which is a Medicaid program for meaningful use, and also for MIPS and MACRA and other national and Medicare specific requirements for e-prescribing. So the value of it is you get the basic information. For example, in the PI program, the Medicaid program, stage 1 requires 40% of electronic prescriptions sent electronically. Stage 2 was up to 50%, and stage 3, which is 2020 and 2021, is 80% to be sent electronically. So those that are still writing handwritten prescriptions, if you do everything electronically, you can easily meet your requirements for stage 3 for the coming year. You can also easily track the prescription fulfillment. So, you know, it gives you the opportunity when you can tell if they filled their prescription or not. It gives you the opportunity to counsel a patient on medication management. There's very frequent, you need to verify the frequency of controlled substance prescription filling. It's a difficult thing to be able to spot the potential drug abuse by using these features of your EHR or your e-prescribing system. It gives you the ability to do that, and then it also gives you the ability to provide counseling to the patient early on rather than waiting until they actually have a opioid addiction problem. It also enables you to spend less time on prescription refill requests. Those of you who will recall back in the day, and probably still today, many of you have the most difficulty with prescription refills. The patients are supposed to call the pharmacy in most cases. They end up calling you. Every day you've got this huge list of prescription refills that you need to go through. If you do the e-prescribing authorization and transmit process, you can do approximately 10 to 20 refill authorizations in just seconds or minutes to be able to get them completed, because everything is there in writing. You don't have to go through a stack of handwritten prescriptions to be able to figure out, is this okay to refill this authorization or not? It's also easily emergency fill process for patients traveling. And I can attest to that. I once went to a meeting at CMS in Baltimore and forgot my medication. I called my doc. He prescribed it, sent it to the Walgreens store across the street. I went over and had my prescription filled, and I didn't miss a day of filling my prescription. That, I think, is particularly important for our snowbird population. If they leave without their prescriptions, their doc could actually prescribe for them from across the country to a pharmacy here in Arizona. Okay, let's talk a little bit about patient safety. As I said, patient safety is not just simply patient safety. It's safety for the patient, but it's also makes their life a little bit easier in some situations, and it's also a benefit for the prescriber as well. So again, I'm not going to go through this list because each one of the slides that will follow will have that list, will have the title of the list in front of it. So let's take a look at the next slide. This is a benefit, a health concern benefit for a patient as well as for a doctor, because the doctor or prescriber wants to make sure that they're covering all of their bases. So instant notification of allergies, drug reactions, dual therapies, etc. So what you will get is a full visibility of documented allergies previous to drugs prescribed. As long as you have those kinds of things in your EHR is often able to pop up those notifications for you so that you recognize that there's an allergy maybe that you didn't realize the patient had, or the patient didn't tell you when they were sitting talking with you when you were prescribing. This will give you the ability to have a pop-up notice that there's an allergy or there are previously prescribed drugs in the same family. Clinical alerts for negative reactions to new drugs. That's also very important. Lets you know as a prescriber what kinds of alerts for what kinds of drugs have negative reactions, could possibly have negative reactions for your patient. Lets you know about duplicate therapies. Maybe the drug is already being prescribed by another doc for the same kind of thing. And that isn't necessarily only for the controlled substances. It's also true for legend drugs as well. It also can pop up and give you notifications that it's a pediatric patient that should not get this particular drug prescribed, or new information about issues with a pediatric patient on the drug. Also alerts to pregnancies, geriatric issues, all those kinds of things. So it pays to at least put that, or at least try putting that particular option, if you have it in your EHR, making it active. I know I've been in provider offices who are prescribing, and I find that they haven't turned that feature on within their EHR system. So that's something I suggest that you take a look at. You can always shut it off again, but I think if you turn it on, you'll find out how valuable it is. And you can always work through the issues of, I don't want that kind of a notification or a pop-up about it. You can turn those off in most systems as well. Prevent prescription drug errors. This is a real big issue. I found a fact that says each year 7,000 plus U.S. deaths result from medication-related errors. And a lot of folks say, well, it's all about the doc's poor handwriting. As we know, doctors are notorious or famous, whichever you want to look at it, for poor penmanship. I have a grandson who is bound and determined he's going to be a doctor because he wants to be a doctor without borders. And I told him when he was learning to write cursive, as you will, which is not taught very often anymore, I told him that that's what causes e-prescribing software. E-prescribing will help them prevent that kind of thing, and that handwriting errors are often the cause of medication-related errors. So that helped him for a while anyway, work on his hand penmanship. I think he's kind of back at it again, but it did help him a lot. So that's not the only reason that we see medication errors. Because it provides access to the medication history, reduces the wrong drug dispensing. We know, and I think everybody on this call well knows, that the wrong drug and the wrong dosage errors are often caused by illegible handwriting and also by just quickly looking at a drug and not going all the way through with figuring out what the name is. So by actually having to pick from a list and then view and approve the prescription, you will be able to better pick out. It's not going to stop all of them, but you'll have an opportunity to better pick out and stop the wrong dosage and wrong drug of similar names being prescribed. Reduction in lost prescriptions. This is very, very important to patients as well as a prescriber. You're not having to repeat things. Paper-based prescriptions are all often forgotten or never filled. I know I've done it myself, stuff it in my purse, go on about my business, and never get there to get it filled. So having it sent directly to the pharmacy curbs that from happening. Also, they're often lost or must be rewritten or called into the pharmacy again. So it's best because e-prescribing of controlled substances as well as the legend drugs prevents that from happening. It's a big plus for the patient because it's sent directly to the pharmacy and it arrives at the pharmacy before the patient. So if there's any issues that the pharmacist sees when it arrives, they can get in touch with the prescriber, oftentimes even before the patient arrives, to retrieve their prescription. So it actually saves time for everyone, the prescriber, the pharmacist, as well as the patient. And patients actually love it. I've often said when I was helping folks get up and live, and some prescriber once said to me one day, I've had so many situations where the patient feels they're just walking away from here and they don't really know they have a prescription and they don't know that what it buys for them. So I've often suggested that a prescriber create a flyer so that you can hand something to the patient. I prefer the 8.5 by 11 sheet of paper, giving a few benefits as to why it's great for them, why it's great for the patient, and it allows them to walk away with something in their hand that reminds them that who they should call for refills, what is the advantage to them, where can they pick up their prescription, is it at the right pharmacy, all those kinds of things. and helps them understand the process a little bit better. This is a really, really great value, that prescription medications are covered by the patient's insurance, can easily be seen by the prescriber, by their EHR system, providing with the patient's insurance formulary. This is really a great, great feature, and I see more and more EHRs and e-prescribing software offering this benefit. It's a really great thing because it lets the provider discuss with the patient what this might cost. That gives you a better understanding that your patient can afford the drug, so that you can understand what the patient's issues might be. Maybe they can't afford to have that drug filled for them. That might give you the opportunity to help them understand how they may be able to go to the drug company to get assistance with filling the drug. Might make you be able to figure out a different drug that is more affordable in a different tier of their formulary. That helps a great deal. It gives the prescriber and the patient a partnership in their drug and medication management. It also, although I don't suggest that a provider or prescriber should go into great detail, helping the patient understand the donut hole or the coverage gap, when many patients know it as the donut hole. I know my husband just in the month of October fell into the donut hole. So we got back to his prescriber and discussed it with her, and she recommended a different drug that was not going to cost him a great deal of money. It almost tripled what his monthly payment would have been. So it was not an inexpensive drug in the first place. So that's my personal experience with understanding what can be done for a patient if they are experiencing the donut hole or an unaffordable situation. And it's a proven fact that it's more likely that the patient will fill and take the medication if it's affordable. It also reduces readmission risk. I didn't really realize this, but it's amazing that approximately 20% of hospital readmissions are due to adverse drug reactions. And that's because the patient doesn't understand how to take them, when to take them. They don't understand how much to take them. So there's really built-in safety features with the readmission to hopefully get a handle on readmissions. It gives you clinical alerts about patients. Some systems alert you that the patient has been discharged. If you are a member of the Health Information Exchange, Current Health Information Exchange, you would get an alert letting you know that the patient has been discharged from the hospital, so that you could call them and go through their drugs with them and make sure they understand when they can take it and when they can't. It also can alert you to, once again, duplicate therapy alert. I can give you a personal experience, an example in this situation as well. Before my first husband passed away, he was in a hospital many miles from our home in northern Wisconsin. So when he was discharged from the hospital, I was handed a bag of drugs with a note in it of what he should take. Of course, in the discharge process, they fired this big long list of things he needed to do and the drugs he needed to take and all that. But no one ever told me when to give them to him, which drugs should be taken in the morning, which should be taken at night, which drugs should not be taken together, which ones are best taken at a different time. That would have been a great benefit for me if they could have gone through it, and it would have been a great benefit for my primary care had he been alerted, as the HIE does in this day and age, to let him know that my husband was being discharged, and he would have called me and discussed the medication process with me. That would have saved myself, our doctor, and my husband a great lot of grief in that situation. So I am a 100% in favor of clinical alerts. So let's talk a little bit about where EPCS statistics are, where we are in Arizona as versus the nation. Now, I've left this slide up. This is a slide I've used in another presentation. I think it's really important for us to look at that e-prescriptions written for opioids, how they have increased over the years. So in 2017, there were about 33 million prescriptions being written for opioids, handwritten. In 2018, I'm sorry, e-prescribed in 2017, 33 million. In 2018, there were 49 million. In 2019, which is the most recent data I could find, was at 67.7 or almost 68 million. So it's an increase of 36%, which is very, very promising and helpful to everyone involved. And it's really, really helped the opioid abduction situation. Also, if I can get to the next slide here, there's been some real updates recently on EPCS legislation. There were, in 2019, there were 13 plus states that had enacted EPCS requirements, and that's more than half of all the United States that were requiring prescriptions for opioids, e-prescribing for opioids. Either e-prescribing for opioids, all substances, or all prescriptions. So I did a little bit of research this morning so that I could talk to you and tell you where we are as of September 2020 for states around the nation in EPCS requirements. There are 12 with current mandate laws, and that is one of the states that we are in, which is wonderful for us. There are many different mandated parts of it. They have current laws that are mandating it, so that means in those 12 states, the controlled substances must be electronically prescribed. Then there are 18 states with further future laws. So they've got some coming in on January 1. Lots of them are coming in on January 1, 2021. So many more of them will be moving into with current mandated laws. There are 4 states with pending legislation. So again, that they haven't really put the law into place yet, but their legislators are working on it, working on what they're going to be requiring as a mandate. And unfortunately, there are still 16 without any legislation or any rules that e-prescribing needs to happen. So I'm hopeful that that will come up very quickly. I think a lot of folks, a lot of prescribers and docs will be going there. There's a new act that's coming out, and it's a long, funny one called SUPPORT, and it actually stands for Substance Use Disorder Prevention that promotes opioid recovery and treatment. And those initials, of course, end up to be SUPPORT. And it's a For Patients and Community Act, and it requires controlled substance prescriptions that are covered under Medicare Part D to be transcribed electronically as of January 1, 2021. So I don't think there's anybody in the state of Arizona that's in trouble yet. As far as I know, almost everyone, well, everyone who wishes to prescribe controlled substances are doing it electronically. I know that in January, I had over 40 calls from docs that were telling me, I just wrote a prescription, gave it to my patient, patient took it to the pharmacy, pharmacist would refuse to fill it because he was forbidden to by state law. So then we had to scramble and get them set up to be able to use e-prescribing as quickly as possible. And let's see. For the state of Arizona, we haven't moved much, and it's because everybody, as I just said, almost everybody in the state who is going to e-prescribe is e-prescribing at this point of controlled substances. So we remain 4th in the nation. At one point we were 3, but then good old Iowa passed us up there, and we kind of lost our spot, but I've also put on the slide for you. Number 1 is North Carolina, number 2 is New York, number 3 Iowa, and we are number 4. I've given you the link on the bottom here that you can go to on the SureScripts site and be able to click on the different states that will be able to tell you where they are and what their actual, where they are in their ranking as far as e-prescribing controlled substances are. This is a slide I always put in because I think it's important that we all understand where we are and that we're doing very, very well. So for September, nothing, again, as I said, nothing much has changed because most of our prescribers, all of our prescribers, in fact, are either e-prescribing or they're not prescribing opioids unless they are at a federal facility. So pharmacies for EPCS enabled, 96 nation, 99 for Arizona, and that means, you know, realistically, almost all Arizona pharmacies are enabled. You'll only find a few mom and pops, and you'll also find some federal facilities like a federal pharmacy at Luke Air Force Base or at the Indian Health Services facilities will not be able to accept an e-prescribed. Those, if you are on the borders and you need to see a patient and you see a patient in those areas and must prescribe, you will need to write the prescription, and it is allowable by law to do that. And prescribers in the nation, 55% are EPCS enabled. In Arizona, 74%, which means we are 19% ahead of the national numbers. It's possible that we will see our ranking and our numbers we won't ever lose our 74%, but we are at risk for other larger states to have more folks set up to be able to e-prescribe. So we may see our number 4 rating here to go away for us, which is sad, but it is what it is. So I promised you at the beginning I would give you some great news about the medical, continuous medical education free online opportunity. I was really alarmed to hear on a former webinar when I announced this, someone said, no, it's not active anymore. So I called the folks who do it, which is the Osteopathic Association, as well as the ASU. So what I found out was it has been renewed for another year. So when you click on the link at the bottom of the screen and scroll down a ways, you will see where it has been renewed and you can take the course. I think it's a great course because it allows you to get CME for your licensing requirements. It also allows you to do it online, and you can stop in the middle of the program, go do whatever you have to do if you're called away, and then go back and continue the process. So you don't have to do it all in one setting like you do if you go and take a class or attend a seminar. So that's very good news. Once again, I'll review very quickly our Click for Control information on our website. So what you'll find on our website, and I've given you the link there to get to it, our pages, webinar registration, all those kinds of things. There's some basic fact sheets there. I think with everybody up to date on EPCS, they're not as valuable as they used to be. I used to tell folks to print them out and take them with them to convince their docs that they should be doing this and understand the benefits of doing it. You'll also find the future webinars and presentations. There's some news articles and newsletters. I also want you to know that if you ever need a slide to put in a presentation that you're doing about EPCS or either controlled substances or legend drugs, I'm happy to provide you with some slides. So give me a buzz if you need them. We also, Health Current is also available to present at your events on e-prescribing at no cost. And also we are available to present on the Health Information Exchange if you need information at any of your events, if you'd like us to do that. We also provide free phone-based assistance and email communication. I get a lot of calls and a lot of emails with questions about e-prescribing, about the mandates, about the laws, when can they do it, when, what happens if their system is down, all those kinds of things. And I do get a number of, and I continue to get them, which I thought would be slowing down a little bit, but they continue. I probably get 2 to 3 a day, so we're still in there with getting, prescribers are still getting used to and understanding the mandate. So an example of some of the flyers that you'd be able to get. And here's a list of the upcoming webinar. This is today's webinar. Next month, as I told you, I would promise you that I would tell you Thursday, November 12th from 12 to 1. The webinar will be Controlled Substance Prescription Monitoring Program, the CSPMP, the review of the benefits and requirements, the last one for this year. So if you're interested, go ahead and register here or go on the Board of Pharmacy website or the Health Current website and register to attend the webinar. And then the last webinar I'm going to do on December 9th from 12 to 1. And I thought what I would do there is go through a review of all of the webinars that we have done over the past 2-3 years and just talk to you about all the different EPCS as well as e-prescribing information that we have passed on to Arizona prescribers throughout the past couple of years. So that should be fun for one. It's going to be holiday season, so we'll make it a little bit festive, and then I'll be interested to know, and anyone on this webinar today, if you'd like to email me and let me know what kind of information you're looking for. Are you still needing more information on e-prescribing or basically any form of e-prescribing, either legend drugs or controlled substances? Because I'd like to know what other kind of education you might be interested in us providing to you throughout the beginning of next year. I also thought I would present to you today some newsworthy upcoming events. Number one that I want you to know about is our Health Current Summit this year. I think it's our 11th year. Oh, nope, I'm wrong. It's our 13th year of annual summits. So this year it's going to be virtual, so you will be able to sit at home in your pajamas if you'd like to and attend the trade show. It's going to be Tuesday, October 13th, and Tuesday and Wednesday, October 13th and 14th. At the bottom of the screen, you can click on that link and you'll be able to register. You also can find it on the Health Current website as well. Also, many of you may know, and some of you may not know, that the Arizona Health Information Exchange has been tapped to start the Arizona Advanced Directive Registry program so that you could go to the HIE to find advanced directives. So I've included here a place that you can click to find out more information and donate if you will, because you know it will help support. We are a nonprofit, so it will help us improve the access to advanced directives in Arizona. So if you're interested, even if you're not interested in donating, if you click there, you will understand a little bit more about the program and what that means. And those of you who are not a member of the HIE will have a better understanding how the HIE will benefit you in this area. And also, there are new CMS conditions for participating hospitals on patient event notifications. I don't often have a lot of hospitals participate in this webinar because it is more focused to providers, but oftentimes I have pharmacists from hospitals, so I thought I would include it in webinar. So CMS is going to require that hospitals alert their patient, their PCPs and their PACs when patients are admitted, discharged, or transferred. And obviously, if you are a participant in the HIE, you're already getting that. So if you wanted to learn more about it, go ahead and click here and understand that you are a community provider, meaning a provider in a practice with other providers or a single practitioner. Any one of those are eligible to join the HIE, and it doesn't cost you a thing, only a little bit of time to learn the system and figure out how to do it, but the benefits that you'll get from it way outweigh the learning curve that you'd have to use it. So if you're interested, go ahead and look here, and later on in this presentation, you'll find a way to get to one of our recruiters that can tell you and explain to you what it's all about. You don't have to have special application. You can do it right from your internet or right from your EHR in many instances. So I encourage you to take a look at Health Current there. We also made a great announcement this week that Health Current and CoREO, which is the HIE in Colorado, are in the process of determining if they will merge. We're further down the line than determining when, but it hasn't been finalized at this point. What that will buy for the state of Arizona is, working together with CoREO, we would be able to cover more areas and get more information and be able to pass more information on. CoREO will learn from us, we will learn from CoREO, and all of Arizona residents will benefit from it, as well as providers and hospitals and all others in the state. I wanted to let you know that this webinar has been presented to educate and help, but I do encourage you to review and interpret the legislation and mandate yourself. Back in the day when I was doing a lot of financial consulting for hospitals, I used to say, if you're ever in doubt about what you should do, you should contact the professional or a lawyer who can tell you what to do, and it should be the attorney that would represent you should you run into trouble. So that's what I would suggest you do here. If you have any questions about it, I'm happy to help you for your specific situation, better understand the legislation and mandates. So that's an offer from me. I also wanted to thank Dr. First, which is a software company, and I don't normally do anything that is promoting. We at Health Current are we do not promote any other kinds of systems or anything we recommend. We explain things about it, but we don't recommend. But I wanted to recognize Dr. First for offering their smartphone EPrescribe application to Arizona prescribers at no charge. That application is wonderful for doctors who travel. A lot of dentists are using it because they can prescribe at night from home. If they're the type of dentist who is doing extractions at other dental offices, they can write a controlled substance prescription, or any prescription for that matter, at the other office. They don't have to wait until they go back to their own office to do it. And of course, they can do it anywhere, 24/7, in or out of their office. So I also want to thank Dr. First for making that offer, because I remember I told you about 40+ docs that called me and said they didn't have e-prescribing of controlled substances and they needed to get up and going fast. That EPrescribe application turned out to be a godsend for them, because they could get up and live on that system very quickly and be able to learn how to use it, and then began to add other ideas and other things to it. And I also wanted to let you know that this webinar was inspired by an article published by Dr. First, and it was entitled 13 Benefits of E-Prescribing. So if you wanted to visit the Dr. First website, I've given you the link here to click on it. Again, I'm not promoting or suggesting you use Dr. First. I just wanted to thank them for offering that application for free to our prescribers in the state of Arizona. And that concludes for today. I'll put my slide up that will give you the information that you need to contact me. Please don't feel that you can't contact me through our email address, erx@healthcurrent.org, or you can call the office. Of course, I'm not working at the office through the pandemic, so I highly suggest you call my cell. I've given you my personal cell phone number there so you can get in touch with me. You can call the office and leave the message. I will get it eventually, but it's a lot faster if you call the cell. Please don't call me in the middle of the night. Thank you. Also, as I said, if you have any information, if you want any information about joining the Health Current HIE, please go ahead and call the number listed there. And also you can email at recruitment@healthcurrent.org. Lots of knowledgeable people that will help you through there. It's led by Jamie Pina, who is just excellent, understands the HIE inside and out, and can help you with almost any question you'd have about it or any need that you have to learn more about it and anything you want to know that how it will benefit your particular practice. And that's all I have to say today. Christine, do we have any questions in the chat box?
Hi, Connie. So far, we don't have any chat questions that have come through, but just a reminder that the chat box is open to ask Connie Cohen, Director of Programs, questions about today's webinar or other EPCS questions in general. So we'll give folks a few minutes to type those in. And thank you today, Connie, for today's presentation. It's extremely informative.
Thanks, Christine. I enjoyed doing it. I think we can end, Christine. If anybody does have a question that they want to ask, please feel free to email me or call me, and I'll be happy to answer for you. Thank you.
Wonderful. Thank you, Connie. Everybody have a wonderful day. Stay safe out there.